Hi, my name is Justin Day, and I will be establishing or demonstrating my PICC Line Dressing Change for the fundamentals class today. So, without further ado, go ahead and let us begin. My first step would be to go ahead and adhere to the principles of ADIT, and at the same time establish the identity of my patient by asking their name and looking at the wristband or any other identifier that they may possibly have. Then I would go ahead and ask them to turn their head to the side or to put on a mask, whatever is most convenient or best for the patient at the time. Now, go ahead and start a hand hygiene, of course. Get the hands nice and clean and put on some gloves. And good. We will open our kit up. And within the kit, first thing I'll take out is the face mask. Blue side out. We'll get the face mask on. Now, at this point, I will start to change the old dressing that was previously there. At the same time, I will look at that dressing, make sure there's no edema or anything weird or infections going on, or the line is inserted into the arm. And we'll begin to carefully peel this old dressing off. At the same time, be very careful with the line that is already there and trying to minimize discomfort for the patient. The dressing is out. We will remove the old gloves. Good. Now, start to get ready for my sterile field and sterile glovings. Take the gloves out and we begin to open the package that is there. I would try to be careful here to make sure initially that this is out of the way so that way we're not contaminating things. So you want to make sure that this part is clear before we do anything. Alright, so we'll grab the outside edges and we're going to set up our sterile field here. Okay. And we'll work on sterile gloving right now at this point though. So, grab a glove on the edge and get these gloves out. And then with the second one, I'll go ahead and scoop abductor thumb and get this next glove on. Now, like I said before, when we're doing the sterile field, we want to make sure that this is all clear. That's something that I didn't do. But when you're setting up your kit, put it away and everything away to where you can have a sterile field. You don't want any of that stuff to be touching this stuff. This is something that I did, but acknowledge that. So at this point, I'll begin to assemble and get my kit ready. So let's go ahead and take everything out. So all this stuff is sterile. It's okay to put it on our sterile field. And we will assemble things in the way that we're going to use them. So date stuff would be last. Take it on would be next. Sure prep. Chlorhexidine. Now, take the chlorhexidine out. There's 3 swabs inside of it. We'll use all 3 swabs. Each swab will scrub around the wound sites. 30 seconds. Swab 1, swab 2, and swab 3. Now the last and final swab, do a little something extra with this here. And we'll go ahead and get the line itself as well. So nice and clean. Again, all chlorhexidine wipes stay on for 30 seconds. We don't want to fan this area or add any more contaminants. Again, I want to use it as aseptic technique as possible. And once that has dried, we'll begin the next process, which is our sure prep. So let's take the sure prep out. And with the sure prep, we'll use a window pane type motion to establish the outside edges of the dressing turgidin patch that'll be there. So it's like a window pane around the insertion side of the capillary. Okay, Tegaderm. Take this out. And go ahead and open it up. Just careful as possible with it here. Open. Okay. And and with the Tegaderm, what we want is the insertion point to be in the middle of the window here. Okay. And then we'll just go ahead and go around there. Now we want the end of this to come out right on the little end of the chevron part here. Okay, so the pigtail comes right out the edge there. Okay. Now, we'll take the bottom part of the tape, here a little chevron, and what we want to do is create a nice, safe little secure area for this piggyback, and get in right here, and put it right there in the middle. Notice how the piggyback comes out of that little point right there. Alright, and our last part would be to go ahead and put the date and time on there so they know who did the dressing and when it was changed as well. Okay, and go ahead and deglove and start to clean up. Thank our patient very much for their time and allow us to work on them, and that we will also be checking up on them soon. Anyways, that's my video. Thank you very much. See you next time.